Hello, everyone. My name is Anita Mbanda. I am the co-director of Women Empower and Mentor All in charge of systems and sustainability.
And my name is Becky. I'm also co-director at Women Empower. I'm in charge of impact, research, and content creation. So we are here to talk about the CGT impact.
All right. So we were funded in between 2021 to 2023. We had the Empowerment for Us study that was being funded by CGHE. The principal investigator was Professor Gary Harper. We also worked with Laura Jadwin Chakmak. And the purpose of the study was to understand how LGBTQ women define empowerment and how power and powerlessness affects their mental and physical health.
Yeah. So part of the study was because there was a major gap when it comes to finding LGBTQ data, when it comes to what health means to us and how it affects our physical and mental health outcomes. And so this study was done between 2021 and 2023. And we were able to find amazing outcomes of which we are still disseminating under the Aries grant. And Anita can talk more about the findings of the E4U Bio study and its impact on our community.
So first of all, Women Empower and Mentor All is a result of the E4U Bio study findings. The research study we realized that we had a lot of gaps that the community were facing, but the most critical ones was around mental health. Most of our community members are facing intersectional stress and oppression, and so this translates into anxiety and high mental strain. Secondly, we also noticed that most of the people who participated in the study, that was 227 LGBTQ women, only 18% were able to further their studies beyond the secondary education. So we realized that our employability skills as a community is also quite low. And then on to the third one, we realized that there are gaps around civic and political rights in terms of even engagement, knowing where to get help, what to do. So we also created a program known as Tujijenge, which is a socio-political consciousness and awareness program that is meant to address the gaps that we realized from the E4U Bio study.
Yeah. And also during the implementation of this grant, we were very fortunate to have access to trainings. And we were trained by the University of Michigan School of Nursing on global health equity, what the social determinants of the health are, and we were able to align these training outcomes to the development of a strategic plan, a strategic direction, and we are able to develop a framework, our theory of change, where we would like to see more safe spaces created, more LGBT persons engaging in civic and political processes, more LGBT persons understanding minority stress, intersectional stress, and are able to cope with these daily stresses of life. So we have designed programs as a result of that study. And Anita has just talked about them. So these are ongoing programs, and we meet twice a month for every quarter. So in a quarter, that is 4 months, we meet 8 times in 4 months. So it's in itself self-sustaining, because now the E4U Bio study helped us develop a process of empowerment model in which Anita loves to talk about. Over to you, Anita.
So the process of empowerment model typically just shows us how, as a community, we move from a point of powerlessness to a point of power. So we realize that we both need tangible and intangible resources over a period of time. And indeed, the CGHE grant has clearly shown us that when people have resources, they are able to move from a point of power, from a point of powerlessness to power. Another thing that was unique about the CGHE grant is that, first of all, we did this project like 90% of it online. Yeah. That was something very amazing, and it was like a new experience for us. We have learned to keep time. Yeah. We have learned to have meetings, short meetings. So this was a very insightful project. The grant is very flexible. There is no micromanagement. The program also had other different programs that are able to build you beyond what your professional is. I am an accountant by profession, but right now I can do data analysis, both qualitative and quantitative. I can write proposals. I have done trauma-informed mental health intervention. So the CDHE grant, I would say, has opened up me as a professional to be able to know that I can do more beyond accounting to be able to help the community. I now even make better budgets because I'm able to understand the theory of change. Initially, that was just a jargon to me, but now when programmatic terms are used like theory of change, I look at the end result. I'm able to ask questions to the program person like, what is this activity going to achieve? How is it related to the outcome of the project? So CDHE has empowered me both individually and even as an organization.
Yeah. So I just recently, Anita has just now talked about her very wonderful skills that helped us design and improve our consent forms during our emergency food distribution drive. Anita was able to look at it and design it in a trauma-informed way as a result of the training you did in December.
Yes.
The training was...
it was social and behavioral science research training that was also done, that is also being funded by CDHE under Professor Gary Harper as the principal investigator.
Yeah.
Yeah.
So we are happy. CDHE is changing lives. It's strengthening our capacities to manage our financial resources. It's helping us harness tangible and intangible resources. It's helping us build safe spaces for our community. And finally, it's given us the visibility that we need as LGBT persons in Western Kenya. And that's it from us. Bye.